Well, hello, welcome back. So this video today that I'm going to do is going to talk about my 1 month post-op, how I'm doing from my parathyroid surgery. So if you didn't watch my first two videos, I believe, I think it was two. I did one up to like diagnosis, and then I did one from surgery to day 10. So we're at a month as of Friday. Today is Sunday. I will insert a photo if I can, but you can see. Oh, is my hair in the way, or is that just a lovely shadow or my fat? So it is a pretty good, I would say, quarter-size swollen piece here. I don't know. Some days I feel like it's gone down a little bit. Some days not so much. My scar, I've been using BioLife oil on it, I believe it is, and then using scar patches at night. I've been using that since I saw my doctor at 10 days post-op. He said I could start putting those on, and you have to leave them on, like it gives you a schedule for irritation. My skin is really sensitive, so now I do it for about 10 hours at night, 10 to 12 depending on like how much I sleep, I guess. So I am doing that because I am prone to keloid scars. Now, I only know that from moles that I've had removed. And, well, my C-section, my emergency C-section with my 7th kiddo was, let's see, 2015, so 10 years ago. That scar is like, I couldn't even tell you that it's there, honestly. But I had a breast reduction 6 years ago. I believe it was in, 7 years ago. Wow. And I've got some pretty bad keloid on one side. I don't know why that was, but I do. So I know I am prone to it, and I did everything the same on both sides, but the one side I have more scarring on. So I am more prone to scarring, so I have been trying to be good about that. As far as symptoms, I told you in my first post-op video that the bone pain I had for 9 years, I woke up and it was gone. I still do not have any bone pain. I was thinking about that this morning as I got up, and I was just like, praise God. What a miracle that I don't feel like I'm 90 years old. I think that was the hardest part of my, is just the fatigue and the bone pain. And so that part is gone. As far as the fatigue, I feel like I'm doing better. Yes, I should say I am, because we went to the mall last night. My daughter went to meet some of her friends, so my husband and I went to the mall because it was just like 2-hour difference, and we live about 20 some minutes from the mall, or from where we dropped her off. So we didn't want to run all the way home and then back, so we just ended up going to the mall, which was about 10 minutes away. So I was able to walk from one end basically to the other end without difficulty. Now, I went to the mall about, I think it was at 5 days post-op, and that was terrible. I couldn't even make it to Bath & Body, which is on the first hall of the mall. And our mall basically has 3 intersections. And so I couldn't, that's as far as I could make it. And I said, okay, I'm done. We need to go home. So yesterday I was actually at the mall and able, like I said, to get that far. So I did do well. And I haven't started working out yet, only because of this swollenness. I had a really bad, with my C-section, I ended up with that postpartum hemorrhage, which was 10 days after, and I almost died. That's another whole story. But so because of that, I have a lot of anxiety as far as the first 30 days. First, it was the first 2 weeks, and then now it's the first 30 days, which we're at. Officially today is the 12th. So for me, I was just worried, what if something happened? What if I work out and then I tear something? I don't know. I just kind of had this big anxiety about it. So I think I'm going to try slowly to work out this week after work. Now, my workout is spinning. That's what I used to do an elliptical until I got my spin bike in 2020 because, couldn't go to the gym. So I always, so in 2020, my high elevated calcium that they missed was going back from 2016. So I've always felt like I did my workout and I could do it, but I just felt like I never got stamina to where I should, because I worked out 3 to 5 days a week, you guys, for a long time. I would say the last year it's been bad, so I haven't worked out consistently, which is my own fault. But I want to get back to that because I really do enjoy spinning for my heart health, not necessarily for weight loss, because I don't feel like I've ever lost weight just by doing that. I have to just completely change my diet with that. So it is really for me personally a diet change, which I am working on every day. And so I want to do that. So that is my plan. When I saw the endocrinologist at 3 weeks post-op, he said about a month and then start slowly. And I did tell him I spin, and he seemed like that was okay. So that is my plan this week, is to start with my healthy eating. I just will have to increase my calories just a little bit with my protein. So that's kind of my plan this week, at least 3 days. And my 3 is Monday through Friday, but I will count the other days. If I don't meet that goal, I'll go Sunday to Saturday on my calendar, like that, my planner that I have. But I try to at least do 3. Once I get up to better, I'll go to 5 days out of those 7. That's what I used to do. So as far as bone pain is gone, the fatigue I feel like is improved. Now, can I say that it's back to baseline? No, because it's a month post-op. Like, I feel like I'm not 100%, if that makes sense. I did go back to work at 3 weeks. How do I feel about that? Now, I work at a computer, answer the phone, so I just had to be careful with my parathyroid because it was ignored for 9 years. I shared this in my last video. It was normal as I think 3 to 5 milligrams per weight. Mine was 803 milligrams. So mine was wrapped all the way around my right vocal cord. So I find if you hear me pausing, I feel like it's still because it just takes a little bit out of me. And then you've got this lump in your throat that is just very awkward, and I'm very aware of it. So I just had to pace myself in calling our patients, and we do monthly check-ins with them. That's part of my job. And then I triage patients on the phone, and then a lot of my work as a nurse is behind the scenes. I'm very proud of what I do for my patients. Basically, my job is to make sure that all of their care in the last 6 months is compiled in a care plan. So if they walk into the ER or go see one of their normal doctors, they can look at our care plan as part of complex care, and they know what's been going on the last six months. Anytime a patient or doctor calls me, I pull up the plan of care that I work on. It is such a very essential part of their plan. And as a mom who had a child with special needs, I'm very appreciative of our program and what we do for our patients. So I'm at a computer, so I think the biggest thing is my neck. Like, it's still, the last day or two, I will say that the tightness has gotten a little better. But this week at work at 3 weeks, I was kind of like sitting like this because there's so much tightness in your neck. So I would have said I should have just taken a month off. But like, my surgeon was like, oh, you could go back to work in an office in like a week or 2. And I was like, no, you're giving me at least 2 weeks because it's my body. And if you see my other videos, he's the same doctor who told me I wouldn't have any pain. BS. Go watch that other video. So I will link the other 2 in the description, and it'll be part of this playlist. But I would have said a month for a lot of reasons, and I work in an office. Also, I feel like as a society, I'm a hard worker. Do not get me wrong. Like, I'm a go-getter. That's just who I am. But I also think we don't take enough time to take care of ourselves in this world, that we just are push, push, push. And I feel like a month probably would have been a better estimate. And that's what I would say to you if you're starting this journey. If you can go back before, then do it. But I also think that my job is sitting at a computer. If I would have had to work at the hospital, like I was working in the hospital a year ago, I wouldn't have been able to go back. I literally wouldn't. Just the pain, the tightness, like Friday from working all week, my neck was super sore and tight. Now being off the last couple days, it's helped because I can use my ice pack. I can use my neck pillow, things like that. So I would say maybe just ask for a month. If you can go back, then go back sooner. Again, you have Family Medical Leave Act, so they can't push you. And I already talked about making sure you had pain medicine and a neck pillow and ice after surgery in the other video. So I think as far as GI symptoms, which were a lot of my other complaints, panic attacks, anxiety, feeling overwhelmed, overall, I got to tell you that I feel pretty good about those things. I will say that I've been struggling the last week with just this sadness about not feeling myself. And I don't handle surgery well. It always affects my mental health because I just don't do well with all those they put a lot of medicine in you when you have surgery, and then you're taking pain pills, and then you're taking Tylenol and ibuprofen. I just don't do well after surgery. I didn't do well. I remember this with my breast reduction. I remember this with my emergency C-section. This is why I was very thankful I was able to have my kids naturally. I had an epidural with my first, and I made him turn it off because I could not handle it. So that's just how I am. I don't like medicine in my body. I just know my body. So I just feel like I've been kind of down and sad this last week because I'm angry at the 9 years of being misdiagnosed. I am angry that I had to have surgery because I didn't want surgery. And here's the caveat to that. I'm allowed to be angry at the same time as both of my siblings are fighting metastatic cancer. And I know that I'm trying not to act like my journey in the surgery is so hard, because it's not in the grand scheme of life. But the fact that I was ignored for 9 years, nobody listened to me. They just basically said it was my anxiety, it was my grief. And then to help my sister, the last 8 years with her cancer. And my brother was diagnosed a year ago with a terminal brain tumor. And anyway, I understand in relative, I don't have metastatic cancer. I'm very thankful for that. But I'm also going to sit in my own feelings because I'm allowed to do that. I have done everything in my life to help anybody that I can. And I just feel like sometimes I want to sit in my own pity party, and I'm just going to say you're allowed to feel that way. It's just like when I lost my son. Nobody's going to tell me what I can feel today. I'm going to feel what I want to feel, and I don't care if you think I should feel a certain way or behave a certain way after losing a child. That completely changed you. It destroyed me. It broke me for at least a couple of years. And that, again, my symptoms started right around the time my son died, so they just blamed everything. So, personally, I feel that I've been very emotional mentally this last week with those kind of feelings. So I'll just say it's post-surgical. You're going to feel a lot of things, and just give yourself grace, give yourself time, allow yourself to feel what you need to feel to get over it. And again, in my case, it was because it was ignored for 9 years and basically misdiagnosed. So I'm a little angry about the whole situation. So I feel like that compiles all of this. But I want to say at the end of this, I'm going to close this video to say there is light at the end of the tunnel, and you're going to get there. And I do feel so much better than post-op day 1, okay? And the biggest complaint I have is just the tightness in my neck. When I swallow like that, I take a little bit more time because it feels like you have a little bit of a lump or a pull in your neck. So be careful when you're drinking. Still use the straw. I find that has really helped me. Don't be tipping your head back a lot, to drink, because it is pretty sensitive. Using ice still if you need to. Using, not over speaking for a little bit, because like I said, I find I get a little bit tired or my voice will start cracking. And again, mine, I didn't have any trauma per se to my vocal cords, but because it was wrapped around my right vocal cord, the surgeon did say that I could have some, it takes time to heal. I wish the swelling would go down. Like I said, I feel like today, I'll insert photos maybe of the last couple weeks, but I feel like it is a little bit better. When I went to see one of my friends who had the same surgery, and she almost died from her she just wasn't feeling good. So she just kept playing it off, and she collapsed and almost passed away from the same diagnosis that I have. That's why I feel very blessed that I had a good doctor that finally listened to me and said, let's just go through your labs. Let's talk about things. And as soon as she saw that calcium, she was on top of things. So I was talking to my friend last night, and, she's always struggled with her weight. So she always thought her symptoms were associated with her weight. So I was saying to her, I feel like my scar is very noticeable. The lump in my neck is very noticeable. And she's like, well, you're smaller than me, so you're going to see it. And you notice it, but I didn't notice it right away. So I appreciated her saying that to me, because I feel very self-conscious about it, but also at this point, it is what it is, But even at work, I found myself this week just kind of ducking my head as I walk past people, and wearing my sweater and stuff so I could kind of tuck it in when I went out of my office. So I'm not 100%, but I feel like I'm getting there, like 80%, I would say. But I would just say have expectations that you are going to have some tightness in your neck. I feel like I had a lot of swelling compared to photos that I've seen. My doctor said maybe it was a little bit more, but was still within reason. But I feel like it was more. Like I said, I've had multiple surgeries, and I just kind of know my body, and I just feel like because, and also my scar, he told me it was going to be like this big, and it's pretty large, I think. It's, here, and I can feel the other tied knot right here. So, like, I think it's pretty big considering, he made it sound like it was going to be pretty small, and it was on the right side, so I'm not exactly sure why the scar had to be so big. But the doctor, like I said, was probably in his maybe 40, so younger than me. But overall, I hope that if you watch this video, it is helpful. And please, if you see this video first, please watch the other two if you want, or especially post-op, the post-op to day 10, because I hope that will help you in your journey. And again, if you see this and you're ever see your calcium elevated, please, please, please be your best advocate and request a repeat and request an immediate parathyroid level draw, because it could save you 9 years of pain every day of your life. And again, I was tested. Go watch the first video. They tested me for every connective tissue disorder, Lyme's disease, multiple times. They thought it was my gallbladder. They thought it was my kidneys. They thought it was reflux. They thought it was all these things. And it was my parathyroid. So again, they blamed everything. I'm sure I have thousands and thousands of dollars of bills that they just misdiagnosed me for. So I do feel like I'm headed in the right direction. I have been eating gluten and it hasn't been bothering me. That was one thing I did because we were trying to lessen the symptoms. I feel like that's made, like, I'm just perplexed that I can eat gluten all of a sudden again. Now, again, I'm still okay with not eating gluten because that's just, I know it's a trigger of inflammation in my body and I feel it. Like, I just feel different when I do eat it, but it's not causing me the GI pain. It's not causing me the leg cramps and aches at night. It's not causing the GI distress where, like, my stomach is like, I'm in pain in a knot with my heating pad and my pillow. Like, it's not doing that anymore. So again, just kind of at the end of this, and I know this is gonna be rambly, but this is just me, is I'm pissed that for 9 years I changed my whole life. I bettered myself, which again probably ultimately helped with the symptoms, but I changed my whole life because they wouldn't listen to me and do a simple test that said, when I met my endocrinologist, he immediately said, I learned in residency, if you're elevated calcium, you check a parathyroid. I work with kids with complex medical needs. If they have an elevated calcium, the doctor immediately orders a parathyroid level. So let my terribleness be an example, hopefully to you, and just be proactive in your care. And the same thing I've learned with my 2 siblings is if you have a symptom, fight until you get an answer that it hopefully doesn't lead to metastatic cancer. Because my sister too was ignored for quite a long time. And then by the time she was diagnosed, it was obviously bad. My brother, brain cancer is kind of hard because usually you don't have a symptom until it's pretty bad. And his first symptom was a seizure. And at that point, it's been not good. So I just, as a nurse, I just want to say I tried to be my best advocate and the system failed. Hopefully the system will not fail you. But again, we're all human and we make mistakes. But just like my son and his birth brain injury, sometimes people don't care enough about you and your family. You have to care a lot about you and your family and be the best advocate as you can be. And I'm saying that as a nurse, and that may make you angry, but the reality is we're all human. People make mistakes, and sometimes mistakes can lead to death or very long suffering. So sorry, this is kind of like good, bad, in between video, but I hope it's helpful. Take from this video what you will, and I just hope your journey is better than mine was. Bye.